Hello and welcome to Chesapeake Weekly Home Edition. So there was another edition of the Mayor's Emergency Response Roundtable recorded last week, so it is available now at youtube.com/Chesapeake Television. Mayor Rick West invited Dr. Nancy Welsh and City Manager Christopher Price on to discuss all things vaccine. So it's a really great conversation. I hope all of you will tune in and listen to the whole thing. But there was a particular conversation that I found really interesting. So we've been hearing about the new Johnson & Johnson vaccine. And while it's only the one shot that you need to get, there's all this conversation about its efficacy and how it's slightly less than that of the Moderna and the Pfizer. So that was a question that the mayor asked Dr. Welsh. And Dr. Welsh kind of said that we need to start reframing how we're thinking about this, thinking less about are we going to still catch COVID-19 even once we're vaccinated, and being more concerned with if we catch it, will it lead to either hospitalization or death, because those are really the key things we're trying to avoid. And no matter what vaccine you have, it's going to help with those two important factors. So here's Dr. Nancy Welsh with more.
Well, it depends on how you're defining not as effective. The percentages of effectiveness are related to your chances of getting infected. What is key for all three of these vaccines is that they are completely the same in terms of their effectiveness on reducing severe illness, on their effectiveness of reducing hospitalization and ER visits, and on their effectiveness of reducing death. They are completely comparable on those major determinations. But with the J&J, as we sort of call it, with the J&J, there may still be a greater chance that you might get a mild illness as opposed with the Moderna or the Pfizer. So it would be more like a cold. Let me just do a comparison. Flu vaccine is historically only 40 to 60% effective, but we still push it. And why? Because where it's most effective is exactly as these three vaccines in preventing major illness, hospitalization, emergency room visit, and death. But even with these 40 to 60% effectiveness with the flu, some people may get mild flu symptoms, the same as it is here with COVID. The J&J, there may be a greater chance you might have mild illness, but with regards to the major impact of severity, they're all the same.
And just a reminder, vaccines continue to go out here in Chesapeake. The Chesapeake Health Department is still using that Chesapeake model. They are partnering with local pharmacies and private care providers to get vaccines out to those who qualify as quickly as possible and without wasting a single vaccine. If you have not already, please be sure to pre-register at vaccinate.virginia.gov. You can also call 877-VAX-IN-VA. Make sure that you're on that list. And if you haven't gone back in over the past couple of weeks to just check on your information, make sure all of it's still accurate, now is also a good time to do that. Well, thankfully, we made it through snow season. I feel like I should knock wood for that, but we made it through relatively unscathed. But now we are headed into severe weather season. So tornadoes, thunderstorms, and in just a short couple of months, hurricanes. So now is the time to get your family prepared. We went to the emergency management senior planner, Bobby Jellermine, to give us a few tips and information on how we can best be prepared headed into severe weather season.
So this time of year is actually one of the most volatile times of year when it comes to severe weather. Tornado season typically runs from March until the first week of June when hurricane season starts. And one of the most key things that you can do as a citizen, one, you can sign up for Chesapeake Alert, and that will provide you up-to-date information. You can sign up for weather alerts. And the second thing is, if you have one of these, a smartphone, you can make sure that you have your some type of weather app and you have your alerts and your notifications turned on. If you watch the news on a daily basis, typically they're going to give you some type of indication that we could have severe weather. Anytime that we have the potential for thunderstorms, we have the potential for tornadoes. So it's imperative that if you do have a smartphone and you have any type of weather app, that you have your notifications on so that if a tornado does happen, you can be notified. And with tornadoes, there's two types of notifications. You can have a tornado watch, which means that there's a potential that a tornado could spin up, and then there's a tornado warning. And a tornado warning means that a tornado has actually been seen, either visible or on weather radar.
Prepare yourself and your family for any kind of weather that may come our way. Make sure you sign up for Chesapeake Alert at cityofchesapeake.net/Chesapeake Alert. And you can also go to ready.gov to learn all about all things preparedness, particularly on how to make an emergency kit and other tips on staying safe. So ready.gov is a great place to go to get ready for what could be a crazy weather season. The Public Works Department is hosting some virtual citizen information meetings coming up. There's a big one that we know you'll be interested in from March 25th to April 9th. The Centerville Turnpike Bridge Replacement Feasibility Study is open for comment. So all the documents and information about the study will be posted on the webpage. It's a bit.ly webpage, bit.ly/Centerville Study. All of that is up there for your review. Keep in mind that there is currently no funded project for a replacement of the existing bridge. The replacement project is going to take years to study, design, construct, and not to mention require considerable funding. Projections are estimating that it could cost over $200 million to replace. That's why Public Works did the rehabilitation project just a couple years ago. That was able to extend the life of the bridge a good 15 to 20 years, giving the city time to prepare for the replacement project. Now, of course, the bridge is currently still closed due to damage sustained when a barge hit the bridge at the end of last year. That repair work is still on schedule. Replacement parts are not the kind of parts that you can just buy on a shelf, so it does take time for them to be fabricated and to be shipped in. They are on their way. From there, the contractors will reassemble the bridge, test all of those repairs, and then they'll reopen it to traffic by the end of March. Stay up to date on all things Centerville Turnpike Bridge by visiting cityofchesapeake.net/Centerville. And it's pothole season here. So every year around this time of year, we see all of those potholes really starting to pop up. And there is a reason for that. So potholes are formed when water seeps into the cracks in the roadway. It freezes, which means it expands, and then it melts again and of course contracts, and all of that freezing, expanding, and contracting breaks up the asphalt, the roadway, and causes potholes. So the Public Works Department is out there looking for potholes, patching them up, but they do want your help. So reporting potholes is super important. You can do that at 382-CITY or online at cityofchesapeake.net/requests. And you know, the Public Works Department is also out there doing total street resurfacing. So we went over to Public Works Information Coordinator Jason Brown to learn a little bit more about what Public Works is doing out on the streets this time of year.
There are over 2,800 lane miles of roadway in Chesapeake, and a lot of potholes can crop up, so we really rely on our residents to let us know if there are potholes on their commute. Last year, probably due to the pandemic, there was a reduction in the amount of traffic on the roadways, so in 2020 we repaired about 7,400 potholes. This year, we're starting to see traffic volumes return closer to normal, and we anticipate that in 2021, Chesapeake's going to repair between 9,000 and 10,000 potholes across the city. So it's very important, again, that residents report potholes when they see them. Call 382-CITY or get online at cityofchesapeake.net and let us know. It's important to know that the pothole repair blitz every spring is separate from our street and roadway resurfacing progress. Every year, the city has a list of streets and roads that are to be resurfaced that year. And we determine which roads we're going to resurface based on what's called the pavement management system. We take data that comes in from computer modeling and from our consultant IMS doing technical observation on the roadways with visual inspection and computer analysis using the age of the roadways and traffic data, crunch that together and come up with a list of which roadways are going to need repair sooner than others. What they're doing is using that van and trailer with weight on it to travel across the roadway and determine how much that roadway surface depresses underneath the vehicle. What that allows them to determine is how much displacement is happening. That gives them an idea of the condition of the subbase of the roadway. That information, compared alongside the age of the roadway, traffic volumes, visual inspection, allows us to determine when that roadway needs to be resurfaced, and we can then put it in the queue with us attacking the roadways that need to be resurfaced more urgently at the top of the list, and then going down the list in order of priority.
So again, report those potholes to 382-CITY, that's 382-2489, or you can easily do it online, cityofchesapeake.net/requests. And if you want to learn more about the resurfacing projects going on this year, there is a list of streets that are scheduled to be resurfaced in this fiscal year. You can find that list at cityofchesapeake.net/publicworks. Just click on the active projects section of the menu. And spring cleaning this time of year is not just a great idea for your house. I'm looking around right now. Trust me, you can't see it, but I need to do some spring cleaning in here. And it's not just inside the house. It's also all throughout our community. We want to start the spring off with a great, beautiful environment to enjoy as we get out there. And that's just what's coming up, an opportunity to do community cleanups in a COVID-safe manner. Here's Katie Cullifer with AskHRGreen.org with all about this year's Great American Cleanup.
So we had some success with this in the fall, and we're going to replicate that same model this spring. March 26th and 27th, it's a Friday and Saturday. We're inviting people to get involved, team up to clean up in their own neighborhoods. In Chesapeake, you can sign up through askhrgreen.org/cleanup. Register to be involved as a group or just as an individual. You can clean up your own block, your own neighborhood. Let us know if you have a place in mind that you're going to be cleaning up those days, or we can help put you in touch with an organized event that you can be part of. The events are going to be small groups. We're going to have masks and gloves, social distancing in place to make sure everyone stays safe and healthy. And we're able to have an effective cleanup working together.
And if you're looking for more ways to improve your environment and to be a good steward of this beautiful city that we have here, AskHRGreen.org really is the place to go. They've got programs and tips and ideas for how to live a green life. They're all very easy. It's an easy thing to start working into your lifestyle, and it's great for all ages. Kids love this stuff. And of course, I know us adults do too. We're really getting into it, especially when it's so beautiful out. We want to do what we can to keep Chesapeake as beautiful as it is. So definitely check out AskHRGreen.org. Well, that does it for this week's Chesapeake Weekly. Thank you so much for watching. Everybody stay healthy, stay safe, and I'll see you right back here again next week.
Don't just learn history, live history. At the Great Bridge Battlefield and Waterways Museum, you'll experience life in 18th century Virginia. Discover the water that defined the landscape. Visit a colonial tavern and find yourself in the middle of the Battle of Great Bridge. Your next adventure begins at the Great Bridge Battlefield and Waterways Museum. All COVID-19 safety precautions apply. Go to gbbattlefield.org for more information.
Mom was diagnosed with Alzheimer's at 58 years old.
This disease just ravages a family.
It changes your life. If we work together, we can stop this epidemic. Now is the moment.
Contact Bright Focus and learn more.
Attention Chesapeake residents, the COVID-19 virus is still among us. If it's in the air, it gets in there. Your lungs, ways to beat the pandemic, staying home and avoiding crowds. If out and about, wear a mask to prevent the spread of the virus. Social distancing equals 6 feet apart. Same goes for the workplace. Visit cityofchesapeake.net/COVID-19 or cdc.gov for the facts. The only way to stop this pandemic is for everyone to do their part. Mask up, move forward. This message brought to you by the City That Cares.